Good evening, everybody. Welcome back to the Board of Health. I know we've had a little bit of an off time. At this time, I would like to not only welcome everybody back, but ask the secretary to make the roll call.
Yes. Roll call. Jean Bishop.
I am here.
District 1, Hunter Adams. District 4, Curtis Manley.
I'm here.
District 5, Nancy, sorry if I mispronounced your last name, Mungu. Mayor Calshini.
Here.
Marley Lucas. Sandra Thomas. And Dr. Dat Wynn.
Hi, I'm here. Thank you.
And we do have 4 of the appointees, so we do have quorum.
Okay, thank you for that. We'll now go into reading the call to the public. Pursuant to ARS 38-43101, a public body may make an open call to the public during a public meeting, subject to a reasonable time, place, and manner, restrictions to allow individuals to address the public body on any issue within the jurisdiction of the public body. At the conclusion of an open call to the public, individual members of the public body may respond to criticism made by those who have addressed the public body, may ask staff to review a matter, or may ask that a matter be put on a future agenda. However, members of the public body shall not discuss or take legal actions or matter raised during an open call to the public unless matters are properly noticed for discussion and legal action. Do we have any members of the public that would like to speak?
Noting none online either.
Okay, I see none, and there's no one online, so we'll go on to the Pledge of Allegiance.
Oh.
Yeah, we don't want to forget that.
On
Please join me in paying allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, under presentations. This meeting portion presents the board with recent accomplishments and new leadership. Following the retirement of Denise Burley, Mohave County hired Chad Kingsley to serve as Director of Public Health. Dr. Kingsley is with us tonight. He began on August the 1st and comes to Mohave County with over 10 years of public health leadership experience while previously working as a foreign clinical physician. He and his wife are parents of 4 children. As per ARS 36-184, Dr. Kingsley shall serve as Secretary of the Board of Health. Welcome, Doctor.
Thank you.
We're proud to have you. Did you have anything that you'd like to say to the board?
Just thank you. I'm excited. This is my first Board of Health meeting. Excited to be here. We'll be discussing the board tonight, just bring up some points as I've gone through ARS and everything, but I'm excited to be here and be part of this process. So thank you.
Okay. And we're happy to have you. So Lynn Valentine is our nursing service manager, and she'll now present her division's recent footprint award and brief division updates.
I just was excited to share with you about Lisa Hatchell, who is our nursing supervisor out of our Kingman office. She recently was nominated and chosen as this year's High-Risk Perinatal Program Footprint Award, which is an award that recognizes one nurse from across the state for their service in the high-risk perinatal program, which we have, which is a home visiting program by nurses who visit families who have NICU babies who've come home. They assist with the transition home. And Lisa was recognized for her exceptional work in that program, and she was presented the award on September 16th during a virtual statewide conference for the HRP program. And we just wanted to, acknowledge that, and we're very excited and proud of Lisa, and she's fully deserving of this this recognition, and we just wanted to give her the kudos that she deserves.
All right, very well done. Thank you. Okay, next will be nutrition and health promotion, accomplishments, and new manager presentation. So Brenda Lobu, is that correct? Brenda was recently promoted to manager of nutrition and health promotion. Brenda is a registered dietitian and licensed lactation consultant and has over 25 years of working with Mohave County providing essential public health services. Welcome, Brenda. Brenda will now present a brief division update.
Sorry. I think you got some old notes. Sorry there. We were just going to decided just to do the presentation, but Brenda and Tara both are just open for any questions.
Okay, so we'll skip
welcome.
any presentation and just go right into questions. So does anybody have any comments or questions? Oh my goodness, do you get off that easy?
Yep.
Would you like to make any comments?
Oh, you just need to turn on your, there we go.
Okay. I'm excited to be a part of the Board of Health. I'm very brand new, so I'm looking forward to the coming year and working with all of you. Thank you.
Okay, thank you and welcome.
Thank you.
Okay, next will be environmental health, accomplishments, and new manager presentation. So Tara Stanek, she was recently hired as manager of environmental health on September the 17th. Tara has a master's in public health and comes to Mohave County with over 15 years of public health and medical experience. She was introduced to the health department and completed an in-depth research report on mobile units for the department. Welcome. Tara will now present a brief division update, possibly, or take questions or comments.
Just a welcome.
I would just like to say I'm excited for the opportunity to work with the health department and help move environmental health in a direction that helps improve the service to the residents and visitors to Mohave County. I am very new to the position within the past 2 weeks and I'm still learning how both the division and the department as a whole work together. But look forward to working with you and reporting on our progress and updating you as we move forward. Thank you.
Okay, thank you. Next is administration, PHEP recognition.
Let me look up real quick.
It's on the agenda, so.
I know, sorry about this. Just wanted to recognize through our administrative division recently, we had some storms that took out power throughout our river valley. And we have a public health emergency preparedness that prepares for these things. And if it could say it could be done as textbook, they went as pretty much textbook. Sunday night, they responded. They worked Sunday, they worked through the Monday holiday to coordinate with the electrical companies, as well as to establish cooling stations. They enacted the Medical Reserve Corps to be able to respond to those cooling stations before the local jurisdictions would be able to respond. And so our Medical Reserve Corps volunteers were able to respond and staff those until they were replaced. And then following that, they continued to coordinate with risk management as well as city jurisdiction to be able to coordinate those responses. And then Nurse Lynn and her team initially, and Lynn would be better about providing names, we had a nurse and she responded that Sunday night, went to Bullhead, retrieved all the vaccines, all the batches, and brought them back to Kingman. We didn't lose one batch because of her service. And then Lynn herself and her staff staffed the cooling stations to provide medical supervision during that time for those that were needed. I had a staff member there was an individual there at the cooling stations that needed a wheelchair. A staff member found one in Kingman and brought it down to them so they were able to have it. So as emergencies go, those are the Red Cross shelters, thank you. And so before Red Cross actually responded, we were able to be there to help provide coverage for those centers and responded perfectly as well as you can prepare for an emergency. we were able our department was able to respond and help during that whole process. So just wanted to acknowledge that. So thank you.
Good report. Okay, I will go on to the consent agenda. We have minutes from the June 8th.
Supervisor Bishop, I would like to see if we have met a quorum. I just heard one member from the district.
I'm sorry, could you say that again?
I'm just trying to see if we made the quorum here because I just heard Curtis here, and I'm not sure who else is here.
So I think we indicated earlier we do have a quorum unless one dropped off.
There's 4 of the 8 members or the appointees. We have to have 4. So we have, from my understanding, we have Jean Bishop, and of right now for it, we have 2 of the. We only have 4 members of the appointees. So in order to get quorum, we have to have 2. Of my understanding, that's correct, right, Tingwei?
Yeah, so as long as we have.
We have Bishop, and then we have. Did one just drop off? Is that what you're saying?
Yeah.
Okay. Let me look real quick. Sorry, teams. Curtis Manley. Curtis is an appointee from District 4.
I'm here.
Yep. And so we do have quorum with the 2 out of the 4.
Thank you,
Yes.
Curtis.
Thank you, Tingwei.
Are we good?
Yes.
Okay. Okay, under the consent agenda, I'll be looking for a motion to approve the June 8th, 2022 minutes.
Motion to approve the consent agenda as presented.
Do we have a second? I'll second the motion. All those in favor indicate by stating aye.
Aye.
Aye. Aye.
Is there anyone opposed? Okay, minutes are approved. And then I have a note here that we also have minutes from the April 6th, 2022 meeting. Is that correct?
No, it was the June 8th, and I'm sorry. I think I gave you a previous copy of the printout for you to follow. So sorry that you're having to amend that as you go along.
Okay. That's great. Okay, Director of Public Health report, Dr. Chad Kinsley.
Just want to report the overall status as we are coming through off which, there's much talk of pandemic and having moved on in a sense from the pandemic and the new normal of those situations. But as you can see, we're responding well within our communities. Overall, the health status of our communities is trending upward, I would say, is positive right now. They're optimistic towards our response and what we can provide to our communities. And overall, just you're going to have a uncommunicable disease, a brief report on that, but just the overall status of both the public health department and from our communities. Nothing to report right now, but in very good status. So, thank you.
Okay, thank you. Any questions for the doctor? Okay, quiet bunch this evening. So then we'll go on to the business to come before the board. First item is a discussion of possible action regarding the Board of Health ARS Title 36. So
Yes.
Dr. Kinsley.
And give me a moment. So for the first part of the presentation, I just took the time, the diligence to be able to understand the Arizona revised statutes and where the Board of Health within each county as well as the state. It's one of the few boards that are regulated by ARS and ARS 316-184. And these are the ones that, just to put in there, for what the Board of Health and what its function is and for us to accomplish. And as many that have or work on boards, we notice that sometimes it fluctuates. It depends between there and stuff. So part of my responsibility, I think, is to help to engage and help provide more engagement from the board so we have more of a stronger participation, but as well as so for our county, while myself and I feel my team are very qualified, the board helps us provide a balanced way to provide all the community input. So it isn't just basically coming from my department, but that we have an oversight or kind of a joint effort between the Community Health Board that can provide advisory positions to the Board of Supervisors to be able to have more, in a sense, buy-in and also be able participation from within our communities. So looking at over ARS, initially, so the board is to advise the director and request from the director information it deems necessary. So at any time, the board, you can take an action to ask for information or request any further information or to enact any type of laws that are within ARS. Part of it is to keep the minutes of all meetings of the board, which falls under me as secretary or the ex officio of the board. Next is the board can make rules and regulations. Not inconsistent with the rules and regulations of the Department of Health Services. So we have to meet those ARS statutes that are defined for public health. But if the board identifies something specific to the county that they feel a regulation could be put forward, they can make rules and regulations to those points to help with the community. Next, advise the Board of Supervisors regarding suitable offices, facilities, and equipment for the health department. So if we identify something within our health department or something even from the cities or something that is needed, that would be recommended, the board could advise, put an advisory position to the Board of Supervisors saying we've identified this need within our communities, and we would advise that you direct the Board of Health to take these actions. Just to throw an example, if a mobile unit was needed, the board here could identify, like, this is really what we need in order to increase access to healthcare within our communities. We would like you to take this action, and we advise this to the Board of Supervisors. So that's as we engage and participate more in both the Public Health Department and the Board of Health, we can take that advisement to the Board of Supervisors for them on those points. And then recommend rules and regulations to the respective county boards of supervisors for adoption and enforcement of their respective counties. So again, we can review over any of the ordinances or the ARS, and again, recommend those rules and regulations be followed. So there was a recent update to 336-184, and I believe it was related to COVID, just that a board or the public health cannot force any type of treatment on a person. And I mean, although the complete language of it, it's being added into it. And it came out of the last legislation. That doesn't conflict with ARS, but it just it ensured the autonomy of an individual and their practices. And then 186 defines a little bit more, but just from my role, that I'm secretary of the Board of Health, which is a non-voting member, but I just help coordinate this and take the minutes. Keep a record of proceedings of the Board of Health, and submit an annual report to the local Board of Health. And these are the points from that and historically we have brought that. And so I just like to enhance that report. And one thing I like in reports is to provide just not the yearly report, but provide a 5-year basis. So I notice it's easier with trends. So, if we see it from our services to any of our communicable diseases, we can see if something's going up or going down. So that will be working to provide that. Most annual reports usually come out after March sometime. We usually give time for the last quarter to submit their data, and then we'll compile that. So most likely in the May or June of Board of Health, we'll be providing those annual reports on a basis. But in those reports, and this is where also you can direct me to add additional things or specific to cities or communities, but overall the county. But it's the condition of public health in the county, activities of the department during the preceding year, the character and the extent of all diseases reported, expenditures of the department, and such recommendations as the director of the county health department deems advisable for protection of the public health. So those are the things, the basic, but we can add more to that. So as the board, if you have any actions or would like me to begin to prepare the next round report, that's one thing I just thought for action today. If any of the board members have would like to direct my department to add anything to that annual report that they would like to see.
So I don't know if you're aware or not, Dr. Kinsley, but next week, the County Supervisors Association will have their legislative summit. And a couple of topics that will be under discussion for possible legislative changes or updates will be Title 36.
Okay.
So,
So-
one is to give the Board of Health more authority, and then there's another one to make it simpler to do Title 36 through the county jails.
Yeah.
So,
Yeah, it's what I've seen with and from other states and Board of Health and some like that. Some it helps them when they have a little bit of more authority to have more engagement and be able to work more hand in hand. I think that's the purpose of it, almost to be like an ethics committee. We making the correct decisions, and also so supervisors as well as a director and his department aren't so isolated. That it's more of a broad community response. And I think that'd be appropriate for Mohave County. So that's great. I'm glad to hear that. Thank you.
so I look forward to your input on that. Okay, any questions? Do we need a motion? Okay, we'll go on to item number 2, discussion and possible action in regards to communicable disease report. So either Dr. Kinsley or Lynn Valentine?
Sorry, it would be Ann, our epidemiologist.
It'll be me.
Well, I thought so, because you usually do that, but I have some notes here I'm going
Yep,
by.
and I
so-
had the right. Sorry about that.
It's okay, you're new. Next month, we won't tolerate that.
Yeah, next time I have to buy everybody dinner or something, right? So, okay.
Well, just to jump on board here, I did make a few little minor changes to the report. If you noticed, you might not have noticed, but I added a little bit more background to put things into better perspective. So we have the case counts for the present year, the numbers we're looking at right now, and then a comparison to what we saw last year, and then also that 5-year median. So that's a way to kind of just give maybe a more accurate picture of what would be considered normal if this year and last year weren't normal. So first thing here, this is Q2. Unfortunate timing here, this meeting, because Q3 will end, tomorrow? So this is already kind of old news, and we're just about to move into the next quarter. But the basics are all there, nothing surprising, nothing terribly different, lots and lots of campy, that GI illness, lots and lots of cocci, and then I warned you a few meetings ago about probable increasing numbers in the carbapenem-resistant Enterobacteriaceae, that antibiotic-resistant group of bugs that's out there, and we're just going to see more and more and more of those cases as time goes along. So there's nothing really surprising there. This goes from January 1st of this year through the end of June. So when you take a look at those influenza cases and the RSV cases, recognize that that was last year, probably between January and I think it went pretty well through May, but that's when most of those cases were. The next respiratory season will start next week. So we'll start over and start counting from, rather than a quarter perspective, we'll look at the respiratory season and we'll start over next week and start from 0 and start counting those cases again.
Well, that's good, because I think I'll be getting my flu shot in a day or two. So
Perfect.
trying to keep ahead of that.
There's nothing on the back side of there, but there were 3 other things that I did want to make note of. And they technically fall out of that Q2 timing, but monkeypox is something we've talked about the last 2 meetings, and it's in the news here and there. And Mohave County has had its first case of monkeypox, and we have had more than 1 case, still less than 10, so we won't say a whole lot about what's going on, but we've had males and females, both. It's been more than 1 service area. And the average age for the cases is in their 40s. So not surprisingly, it's adults that it's affecting there. And some of them have probably been, the infections have probably been acquired outside the jurisdiction, And then there's some possible evidence that there have been some within the jurisdiction. So I do expect that there'll be more cases, and we're on top of those. Mosquitoes is another seasonal one that we think about. And for Tara here, this actually falls under one of her employees over there who does the mosquito surveillance. But we began trapping mosquitoes in Mohave County back in April, and we will continue through most likely October, maybe even further, if there's still a lot of mosquitoes out there, or if the weather, if there's additional monsoons or more of a rainy season. As long as the bugs are out there, we'll probably continue testing. The good news is that the bugs that have been trapped and tested for West Nile virus, none have been positive so far. So we haven't had any positive mosquito pools out of there. We have had enough mosquitoes just based upon the number that we're catching in those traps and the nuisance complaints in the Mohave Valley area to fog, I think, 3 times this summer. So up in the valley area where there's always tons of mosquitoes with the agriculture and some of the waterways there. Nothing too surprising there. It's actually fewer times than we normally have, so fewer sessions of the fogging, but it's been over a greater geographic area, most likely because of these rains that have come through, and it's opened up some additional breeding spots for the mosquitoes up there. She mentioned that there have been more mosquitoes than usual in Kingman. Still nothing alarming, but it's worth it to go out there and set the traps this year in the Kingman area, whereas in past years, you hardly have ever got any. So that's a new thing.
In the Kingman area, the kissing bugs are returning.
Oh, I'll get to that next. Yeah. In Lake Havasu City, they've seen lower numbers of mosquitoes. I can't explain that. I don't know why. But here in Havasu, most of the traps that we set are along the shore, along the water there. So places like Mesquite Bay and Body Beach. And we've seen fewer numbers of mosquitoes in those traps this year as opposed to past years. Just to put it into perspective, we talk about those mosquitoes and we make a big deal of it there, and we have a person who's devoted to it because of West Nile virus, St. Louis encephalitis, Zika, chikungunya, potentially dengue if we had the right mosquitoes show up, which we don't have right now. But just to put that into perspective, the last West Nile virus cases we had in Mohave County in people, there were 3 cases last summer, so in 2021. And some of those were locally acquired. Not all of them, but some of them were. So we haven't seen that yet this year. Last time we saw a Zika case was in 2016, and that probably was acquired in Central America. And the last time we saw a chikungunya case was in 2014, and that was also probably acquired in Central America. Last case of dengue that we had in a person in Mohave County was 2015, and that seems to be acquired in Central America. And then just to throw in malaria there, we don't have the right mosquitoes at this point to have a big problem with malaria, but the last human case we had of malaria in Mohave County was in 2019, and that was acquired in the Pacific Islands. So we got the bugs, we're watching, and Chagas disease. This we've talked about a few times over the last couple meetings. Kissing bugs are prevalent in the Southwest, including Mohave County in Arizona, and they can pass a certain parasite along to people called trypanosoma, one of the types of trypanosoma. And these bugs feed on people and also animals. And the question is whether people who might get bitten by these bugs end up with Chagas disease. And we had an interesting situation earlier in June when we first talked about this because a person had brought a bug to us and said, I got bit by this, what is it, and should I be worried? And sure enough, it was a kissing bug, and the bug was identified as Triatoma rubra, which is a very common type of kissing bug in this area and the rest of Arizona. And it is known at times to have the parasite. And that bug was actually sent to the CDC, and they tested it for the parasite. And lo and behold, they found DNA evidence of a human blood meal. So indeed, the person had been bitten. And they also found the parasite. So we have evidence that the parasite is in the triatome, the kissing bugs in Mohave County. We've never had that proof before. But now we know, which is really not that surprising because it's understood that a huge proportion of kissing bugs in Arizona have this parasite anyhow. But the key is that it doesn't very often get transmitted to people here. This species doesn't tend to, even if they are infected with it, if this kissing bug has the parasite in it, it's not very easy to pass on to the people. And last time we discussed the fact that the way that it's transmitted isn't actually the bug bite itself. It's actually after the meal when the bug defecates and you accidentally introduce that into, either your eyeball or a wound that might be open or something like that. And the key with the triatome rubra, which is the type of species this was, is that they defecate after they leave the body. So you don't have that infectious material near any wound or body part that would cause problems.
That is so reassuring.
It's interesting information, but there you
And
have
if you do happen to get this disease, what are the symptoms?
So it's got an acute phase and it's got a chronic phase. And the chronic phase is where most of the concern is, because chronically you can end up with, decades later, you can end up with megacolon or megaesophagus, which can cause problems, or you can end up with cardiac problems as well. But there are anti-parasite medications that you can take during an acute phase. And of course, right off the bat, it's going to have that whole same group of symptoms that you always talk about: muscle aches, fatigue, fever. It looks like everything else. So it can be treated, and the bigger concern is for folks who end up with it chronically.
Yeah.
And you're much more likely in the United States, at least in the past, to have gotten it from a blood donation or from an organ transplant, but they're testing now for that, so that's not such a concern. But
and just to explain, in the chronic, mega means enlarged, so the heart becomes it's like congestive heart failure, or the same with your intestines. So
yeah, and you can be tested. This person here, if I know that I was bit and I had concerns, doctor can test you for it. During the acute phase, it can be treated. The chronic phase, and later on, if you end up with these problems, it's much more difficult to deal with.
Okay, thank you.
That's all I had to say.
All right.
one thing on that I like to point out, that when you end up working with data and numbers, but it's usually when you have one infection, you see others go down. And so when you look at that and you see how it responds, so if you remember in the early 2012, there was H1N1. When that happened, everyone started washing their hands, and most of the infections in the hospitals all went down in the flu. What we saw with the COVID pandemic is both our respiratory ones went down, flu and RSV. Interesting, when RSV is usually elderly and infants that it affects, put them in the hospital and ICU, and usually it has a season, especially during winter, and then we completely skip the RSV, and then the first time that we removed masks in May, we had an RSV outbreak. So it's just interesting to see how things work, and that's basically how data works, how we look at things and how we know that, well, historically, this is what happens. And so it was, from a data perspective, it's interesting to see those things. So some of the methods that we use, to help prevent that sometimes perhaps, come with their own challenges, they are effective for some respiratory things, heart diseases and such things. But it's just interesting to see that on the data. I'd just like to point that out and reinforce, things do work from washing hands and wearing masks. So when needed. Thank you.
Okay. Thank you for that input. Okay, going on to the next item, number 3, the Community Health Needs Assessment and Community Health Improvement Plan for 2022. And I believe that's yours, Dr. Kinsley.
So this is just a follow-up. Previously, we presented, from my understanding, so I was not here, but the Community Health Needs Assessment and Community Health Improvement Plan were presented to the board. I just wanted to follow up if there were any questions or any actions from there that the board identified that they would like us to take or to make a stronger intervention in. So,
Okay, thank you. Any comments? Any comments from anybody on the line?
I'm good, thank you.
Yes, go ahead.
They said they could.
Okay, I couldn't quite make that out. All right then, no action required on this one. Going on to item number 4, discussion and possible action. This is the Office of Medical Examiner and Medical Examiner Report for 2022.
yes.
Dr. Kinsley, if you want to enlighten us on this one.
So I provided a report, which is, has been provided to the Board of Supervisors recently. Just a brief history in the current contract for our end-of-life services within Mohave County. For the past 15 years or more, the county has sought out individuals and contracted them to provide the services of the medical examiner. Those services are if any type of investigation is needed to an autopsy, or if any, just also to track end of life and death within our community, from hospices to hospitals. And so we have the data for that. It helps us to understand the median age of our community. It helps us understand if we have issues. We saw it with the opioid epidemic of increased substance abuse deaths or suicides, and where we can make intervention at. And sometimes the death data is sometimes just as important as any of our disease, just because it tells us the trends are happening and we're able to react more immediately. Sometimes we can see it within a month or two, or within a quarter, to be able to see if suicides are increasing and stuff. So just history there on that, and the Office of Medical Examiner is part of that with it. So the past 3 contracts, and previously it started with Dr. Worrell, and she fulfilled the contract as the forensic pathologist who performed not only the administrative services, but as well as the forensic physician responsibilities of that. Next came under her, she cooperated and contracted with Dr. Mosley, who then took the next contract. And then at the end, when Dr. Mosley had decided not to continue forward with the administrative portions of that, our procurement within the county, the procurement had been doing requests for proposals to find the next candidate, with the intention that when available, and those funds would be, that eventually the Office of Medical Examiner would be reincorporated back into the county and within the Public Health Department. And that's the end goal. Obviously, in all counties, we sometimes have priorities where we need to put our funds at. So we've been able to manage appropriately with a contract. But there has been a challenge, as with any contract, when sought out, is to provide a qualified person who understands the industry and to provide those services. As part of a recruitment process, the county was able to identify one of the funeral home owners, Serenity Memorial Group, which, through the normal process of procurement, they were scored, they were analyzed if there was a conflict of interest, and so legally and lawfully, they met all the requirements to establish a contract. They, as with any funeral home, understand the industry and the business, and they work with medical examiners. So it was a good fit. This was presented and recruited, and it was not just done isolated. It was a very long process. And the county contracted with Serenity Memorial Group. Shortly, and my report will explain that as going through, that began in December 1st, 2021. And so we're looking at just about almost 11 months now of the contract being fulfilled. And it was with a clear intention with them that, yes, that we will be moving forward to build a medical examiner office and provide those services within the 3 years or during one of the 2 available extensions. It became controversial with the other funeral homes who, rightly so, want to know that they're being treated fairly. And so through that process and a little bit of it, so the first time with this contract compared to Dr. Worrell's and Dr. Mosley's was that because we were bringing somebody that was involved in the industry on both sides, we put in a transparency clause that previously the data that was produced from medical examiner was not open to the public. This time it was. And overall, when it comes down to it, I feel that there was a lack of data and the appropriate management of data when the contract started. But full transparency, that data was revealed, and rightly so. There were questions from both from those stakeholders, from the funeral homes, and those questions escalated to a more severe accusations that are listed in the report. And about this time, this is when I came in. And so taking all those accusations and processes that were put forward and the previous work done, I did an investigation and listed through that. Let me go to that real quick and just show you the basic summary of that from the report that here provided. And the report, looking at the report here, again, you're going to be provided the purpose of it. I did a small glossary because sometimes these terminologies get mixed around from usually medical examiner gets thrown out, but it's a very broad title. It can include most anybody within the medical examiner, so provided that. Provided basically what's the scope of death. So is the Office of Medical Examiner needed or not, and that process that goes through that here in the report. And then basically the scope of the data, the 4 issues that really came up, we saw there that I've mentioned. One was we did the transparency. What next was the software. It was the management of it was within Excel, and it was not stored appropriately when it started. And so that was transferred from Excel to Google Sheets. And anytime you transfer data between one type of system to another, it's problematic. And any university, anything like that, it's most data specialists or science informationalists will cringe, just because if somebody had put a space in that you can't see, when it gets transferred, it creates a duplicate. Just by that invisible little space, it can happen. So that is one strong issue. So there's a tendency towards human error there. Then there's external factors too, reporting. If a hospice that has a death does not report within 24 hours and say a death occurred in March, but they report it in May, then March will be deflated, their numbers, and May will be increased even though it happened then. And so reporting will happen. And currently some of our agencies report via fax, and it's been 5-10 years that the fax is copied so many times it's actually almost sideways. And so we need to improve on that. So there's the reporting in a timely manner, and then sometimes cases too. Cases will, if investigation is ongoing, the death occurred in again March, but that investigation closes in April. Again, it's going to change those numbers. And then so the funeral homes, this data is highly protected by the Arizona revised statutes. Right. And that's the one issue that we have there, that what we can share. And Arizona is very, very, rightly so, controls that data, vital records, very importantly. It's a private, personal record of that person and their family, and it's protected. And so I'll review over that, and that's one of my main things I want to bring to the board to discuss. But overall, I want to give you the encompass of this board and if advisory position or direction you would like me to take even more to look into something on those points. Other side things where, again, it's just a human error of entering. Law enforcement sometimes will close a case and have to reopen it, which is nothing, it just happens. And then it's delayed reporting. So all those things can affect data, how they are. And the current system that was in place was not adequate, but it is improving. But the big question, especially for funeral homes, is why does the office medical examiner data report that my funeral home has 18 cases this month? And but on the invoice I receive, and this invoice is they have to have a permit in order to cremate a decedent, and they will only have 6. And they're saying I'm only showing 6 this month, but you're telling me I have 18. Where are those other ones at? And so all those is what inflated those numbers, and it really just comes down to data management. So in a little bit, by us as a county doing the right thing by requiring a full transparency, we weren't completely there yet. And so we created a little bit of our own problem, but it was eventually going to happen, and we needed to be able to fix it. So when we inherit this, hopefully these problems will be solved. And so if not, this would be us in the situation of the county right now. Same thing, the funeral home's asking, how are we treating fair? What's going on? So this is just an opportunity for growth for us to be able to identify that. And the funeral homes have every right to know that they're being treated fairly on both sides. So as with any industry, sometimes heated arguments can happen, but I believe that we can continue forward on helping those funeral homes feel that they're being treated fairly, and as well as we as the county are representing our contracts appropriately. So
Dr. Kinsley,
Yeah.
I think a good example of this would be the recent pandemic that we experienced, where the Arizona Department of Health had a different reporting procedure than the Mohave County Department of Health. And unfortunately, Denise Burley got the brunt of the criticism on that. But, we've got so many different actors reporting differently. I can understand and see how this information can get duplicated and misplaced, or like you said in your report, the Excel files doesn't seem to be doing the job. So can you tell us a little bit more about the program that you plan to bring to kind of help with this data?
Yeah, so the medical examiner, realizing this started, and he spent, the Surrounding Medical Memorial Group spent 6 months or 5 months demoing different electronic medical record systems that are specific to a medical examiner. So as we know, in any industry, there's always a host of sales or marketing out there to come and buy our software, for a medical, and so it's the same in the medical examining world. So they went through different ones, and they picked the most popular. It will be, again, it's going to help bring it into the more modern age, I would say, the medical investigators, the forensic pathologists. It will be electronic, all those records. And so there'll be less error of filling something out on paper, then having to take it back to the office, translating that, putting that in for human error helps eliminate that. It should manage the data better. So I would ask, patients for 2 to 3 months. So October will be the first month that will begin to be reported from that. So my office, me as the contract administrator, will be working with our contractor to see how that's reported, what it looks like and appropriate, and the epidemiologist will be working with that, as well as the funeral homes. We don't want to leave them out of this. So my goal is to have us all on the same page and working towards that. I don't know the complete specifics of it, but it is an electronic medical record system that is, I believe, about over 60% of medical examiners in the United States use this software for it, and it was the one that seemed to fit most appropriately. It was ready in August, but there is training and staff that needs to be able to do it and understand that it's done correctly. So those are the basics of it. So.
Is there anything that this board can do to assist with this situation? Do you need a motion for to purchase the new software?
Nope, it's purchased. So this is all provided. The money, so the county that provided to the contractor has been sufficient. From the previous, there was an increase for this contractor. The fleets have been modernized. The cars previously, I believe, one of the last two, they had 420,000 miles on it. As we know, we have a large county, and it was in a poor condition. But new vehicles have been purchased. Tablets are now being used, paper's not. So they've gone to electronic. I feel it's going in the right direction on those points. And I believe the money that is provided by the supervisors is sufficient for them to continue that, so.
Okay.
Was there a question on?
Yeah, hi, this is Datwin.
Yes.
Thank you for discussing this topic. I think this is a great service that you're looking at to help us provide for the community. For me, it's from the standpoint of a clinician. I use the old paper system before, and then even as you know, I'm glad you look at it. The electronic system right now is still very clunky, and I'm glad we have a new system. It has to come down to the patient, family members. In the past, a lot of delay, a lot of suffering after the fact that the patient already died. So I'm glad you look into this, and I think it will improve the customer service for our community. I greatly appreciate your insight on this topic.
Thank you. And I think that's what the funeral homes too. They want to provide the best service they can to the next of kin within our community. And I think there needs to be always a dignity to dying that we can help try to provide. So I think, and that's why I'm grateful for the funeral homes bringing it out. And I always say closed mouths don't get fed. And so they voiced their concerns, and we'll continue working forward both with them as well as our contractor to provide. And so that when we inherit it, it's in hopefully the best situation we can have. Just as the scope of my investigations, just so I understand, so I reviewed I have a little smaller screen here, sorry, but I reviewed the available last 15 years. I reviewed the Arizona revised statutes, and I do have one question for the board over that. But I reviewed the Office of Medical Examiner's contract, as well as the funeral home contracts that they have with the county. I met with law enforcement, both county sheriff and dispatch, and I did contact the FBI. I just wanted to do my due diligence and ask if there were any missing bodies or families reporting or asking anything about any numbers, anything. Did not find any. They reported no cases or any calls or open cases on those concerns. I met with county procurement, county attorney, and public fiduciary, and coordinated with them. Contacted the Arizona Department of Health Services and spoke to them, as well as Arizona State Board of Funeral Directors and Embalmers. I met with the contractor and reviewed previous contractual monthly meetings that continue as part of the contract, and I met with funeral homes. And then just as for our epidemiologist received the data, received the up to this annual data currently right now, and performed what we call a scrub. And basically took that information, locked it so it could not be manipulated, and then went through and identified all the problems that we talked about, from the duplicates to reporting errors to those things. And she was able to match all cases. So all current vital record cases that we show through the year, she was able to match those. So we're seeing it's the software errors and the reporting and the issues that we have within our system that really is causing the problem here. So
it sounds like you did a really in-depth follow-up on this. But did you contact Channel 10?
I did not.
I think Channel 10 should receive a copy of this report at the very least. And,
okay, yeah. I did distribute this report to our local media, but I can also send it to Fox 10. So I put my results there, and I also went through each results and on there it breaks down. And then just to thank you. But the one question, so I have recommendations here, is one is data software. Obviously, that's in the process. Next is the data sharing. The other one points is distribution list and reporting and a Board of Health, which I'm doing right now, and body bags, and that's another question. But the big one here is what I need to do with the funeral homes is provide them, have them be part of the process. But overall, this is the issue I'm finding, and I want to make sure that I'm doing something lawfully correct. So each funeral home handles decedent records. They handle vital records. They're licensed, and they also have a contract with the county. But in ARS 36-342, it says disclosure of information. And then this is the prohibition. And this is vital records and public health. So A states, so one of the petitions that the funeral homes has asked is, why can't you send me the decedent information? From a public and from the previous health director and myself, both of us in our trainings, anyone that deals with personal or private health information, we're very trained towards HIPAA, very protective of information. And so our reaction has always been, we cannot and we will not share this information with you because it contains a name, it contains a case number, it contains that personal identifier of a person. But I believe there is a way that we can do this looking at this, and I just want to make sure that I'm on the right course, but I just can't get revised statutes are great at telling you at what you can't do, but they're not great at telling you what you can do. And so that's kind of what I'm finding. So in 36-342, so I would like to provide, it makes sense what the funeral homes are saying. I deal with decedents that are specific to me. I deal with that vital record information. I have those records that I report. Why can't you share that with me? You know, why can't you give me that similar list so I can verify and see for myself that yes, all, you know, that was the data and I can verify all the cases that you have assigned to me for the year. I agree with that. But again, it's that public health reaction of I can't share its vital records. And this is where it's at. It says, A, the state registrar may provide information contained in vital records to persons, including federal, state, local, and other agencies as required by law for statistical and research purposes. I'm the local registrar. So I signed up, and so I'm local. So one, I'm not the state registrar, and this says the state registrar can do that. It says as required by law, and that's where I'm kind of, I have not been able to find an answer from licensing. I can't find a specific law that says I could share this, share this information between these two. And I just want to make sure I'm doing it correctly. And I can see an avenue perhaps for statistical and research purposes, but this is for verification of their business. So that's where we had concerns. Next. Except as authorized by law, a local registrar, which is me, a deputy local registrar, or the state registrar or their employees shall not, 1, permit inspection of a vital record or evidentiary document supporting the vital record. Those would be the records. So that's where our concern is at. Disclose information contained in a vital record or to transcribe or issue a copy of all or part of a vital record. So saying that there, it kind of creates this gray area because the funeral homes manage this vital records. We manage vital records, but I'm not sure if I'm allowed to share that information with them. And so it comes down not even to HIPAA, it comes down to this law. And one thing supporting even more perhaps being able to provide that is so we have a contract with it, and in 16 miscellaneous provisions. So this is the contract that each funeral home has with the county. It says the contractor shall establish and maintain procedures and controls that are acceptable to the county for the purpose of assuring that no information contained in the records or obtained from the county or from others in carrying out its functions under contract shall be used by or disclosed by, and it lists those out. So we have in place with them a licensed funeral home, and we have a contract that stipulates that they need to protect this information. It's just that gray area. And I would like to be able to provide the funeral home so they can verify, but I'm not sure if I'm allowed to. That's where I'm kind of at. I can't get an answer. Now, I am meeting with the director of Department of Vital Records from the state on October 5th. I previously brought the question, but again, I didn't get a direct answer. So I think it's more so we know what we can't do, but we're not sure what we can do.
Yeah, the statute specifically says you cannot.
Yeah.
So I see where the confusion comes in, because in one area it kind of leads you to believe that you can, and then it goes on to say you cannot.
Yeah.
So
I think that's been the sore point for funeral homes, because they're like, we deal with this data. We have licenses. We deal with private vital record information. There shouldn't be anything a problem, but I don't want to do anything wrong.
I always ask this question: what is everybody else doing?
Yeah.
What are the other counties doing? This can't be. Oh, I'm sorry.
Consumers can hear us.
Where am I?
That would be green. Hit the red button.
I did. Oh, sorry.
No, it's okay.
So my question is, what are the other counties doing? We can't be the only county dealing with funeral homes that are disgruntled because they can't get the information they think they deserve, so.
Yeah. I don't think they share the information. Our transparency thing, we put in a transparency clause and we started sharing a certain level of information. And because of those faults, it created this area, and I'm not sure they have encountered this problem actually. It's normally you present pretty much like this epidemic, and in this, this report that Anna presented us tonight, we give you that annual report of death and kind of everything that occurs with it. But to actually break it down to name and case numbers, which they would like to see, is a whole different question, and that's the challenge. And I want to make sure that they're treated fairly, and it's that gray area I haven't found an answer yet to, so.
And the county attorney has not been able to assist on this?
I spoke with Tingway and with Ryan, but Tingway, did you have any advice towards this?
Oh, I think Ryan.
Oops, you'll just need to push your button, sorry.
So it sounds like this may be a legislative issue that maybe we need to have the ARS tweaked slightly so that it's more clear.
Yeah,
Either
possibly.
shall not, or you may go forward. And we can do that. It's a little late to get it on this year, but we could contact our legislators directly.
Yeah. And if it comes to, so let me speak with Vital Records and see how they feel. And if we and Tingway, and we'll work on this together and figure out. So that's a great advice there. If it's something or a clause needs to be put in there, define who can, can you intershare? Because I know even in other states that even between like the state and county, sometimes they develop MOUs just to share data. Even though they're the same government, they still develop MOUs to share data to make sure you're using it properly. So maybe it would just come to us strengthening the language in the contract to make sure that and the method of it. And Anna and Bailey have spoken a little bit on this, but there also could be an appropriate way that is that we can sit down and deliver that data to them, but it would need to be encrypted in a just not sending them a list on an email. It needs something that needs to be done correctly and protected. So we're looking into that. So, and that's basically overall, I think, for funeral homes, so they feel that they're being treated fairly, what I really wanted to bring to the board and to acknowledge, so where we're at.
Okay. Well, I think this is a good opportunity to introduce the Board of Health to our newest legislative representative, Mr. John Gillette. And since he's a freshman on the floor this January, it might be a challenge he'd be willing to take on.
Okay, great. Thank you.
Madam Chair?
Yes,
I have
go
a
ahead.
question for Dr. Kingsley. On the data sharing and the medical records, it seems like the contractor is buying the software or going to be in charge of the software. What happens if in the future the county decides to bring it in-house or use a different contractor with that data?
And so that's one issue, concerns that funeral homes raised. Within the contract, we don't have it, and we are not obligated in any way to, we don't want it to be perceived like he is going to be selling and making money from us in any way. We will have the option to inherit that data sharing, and most likely we will, but we'll just have to analyze, make sure it's the right thing for the county. But we just can't come across in any way that type of relationship exists, and that's in the contract, that he's not purchasing things with the intent that we're going to purchase it from him. So in a sense, we kind of start from scratch. We are going to inherit it. We will be inheriting the employees. They will become county employees, those that will transition over into the medical examiner when we inherit it. And most likely I would say, yeah, we would, if it's a standard medical record system, it would do well. And the one thing I did ask about it is it transferable? He goes, easily. All licenses and contracts can easily transfer to the county. So it's possible. So it's very simple to do that.
Is there an opportunity contractually for the county to be the owner of the software and license it, if you will, to any contractors you have, or maybe work with the Board of Supervisors to do an addendum to the contract that we're guaranteed that data back? It's very complicated when you lose data, especially if it's several years of data.
Yeah.
But I think it'd be important for the direction for the medical examiner's office to be able to have access to that data through public health.
Contractually, all data that he produces, we own. So that is part of the contract that's why he has to send us a monthly transparent, and it was that part of thing. So any of the data or anything that he does produce is owned by the county.
Okay.
As in a business, him operating his business, that's where the discretion comes in. He gets to choose which program he's running the business. We gave him that right. But the data's ours.
Okay. And how long is this contract with this provider?
3 years with an option of 2 renewals of 1 year, so possibly 5 years.
Okay. And is the county then, as I understand it, the intent is at the end of this 3-year period or 5-year period that it would come in-house?
Yes, and I believe the county manager should be bringing a building proposal to the Board of Supervisors within the next month or by November. So that would be the first initial talk to that. Most likely it will be in south of Kingman. We're trying to keep it central to the 3 cities where they are, but it would be, when it brought in, it would be part of my department, division. It would be under the public health. Tied in with vital records, but looking at there is a private prison, is that the right word? In between here and Havasu.
Yes.
It was one of the options, but basically in that area. Any type of medical examining, you don't want it around houses. There's certain time of years it's great, and I think there's an old adage of an outhouse. The definition is 50 yards too close in the summer and 50 yards too far away in the winter. Kind of same thing with a medical examiner. You want to keep it away from a populated community. Certain times of the years, even with cremation, it can emit certain smells. So it's nice to put it out. And we have deserts, so it'll be distance from Kingman, but it will be closer to Kingman.
Okay, yeah, so that actually is my next question, because it's located in like Havasu currently,
Yes.
where the population center
Yep.
is for the county as well, but of course the most southern part of the county, so understand the geographical piece. So are you suggesting that the medical examiner's office is going to be a crematory as well? Because that's not currently what's happening.
I'm not sure if in my opinion, you're correct. And I thought it had crematory services at one time, but it possibly does not, because we do the crematory permits. I have to look into that. I'm not sure if it did or not. Just from my understanding, they went and looked at Coconino and La Paz and one other, and Maricopa. They looked at their 3 medical examiners, took advice from them what it was, and is designing the building after suggestions in which they provided. I was not part of that. That was the only thing. So that was previously done about 8 months ago, the investigation into those buildings. So I don't have the specific answer on that, but I can find out and let you know.
Sure,
I would
that'd
have
be
a
great. And I think
crematory
to
with
follow
it.
up on your comment, Nancy, is I think the other counties already do it in-house. I could be
Yeah, we're the
incorrect.
last one.
Yeah, so I think all 14, there's 15 counties in the state. I think Mohave County is the only one that does not do in-house
Well,
services.
we wanted to, we just couldn't
Yeah.
hire one, so
Sure,
that's why
yes.
we went this other direction.
Yeah.
Yeah.
So
Historically, the reason it's in Lake Havasu is you have better restaurants, I believe. So, but Dr. Worrell, this is where it was more convenient for her. And the same thing for Dr. Mosley, and so it established her. But Dr. Worrell was one who established the first medical examiner here in Lake Havasu City. And it was convenient for her because she was a contractor, and the current contractor can change his location if he chooses. That's part of his business. That's afforded to any contract to them to appropriately run the business. I don't know if there's any if that's intended right now. I don't think it is, but he has that option. Surrounding Medical does have that option, but that's the history of why it's here in Lake Havasu City.
and I'm not advocating for it to be here or not, but obviously we need to do what's best for the entire county. And if the population is in or around this area, you would think it should be in and around that area.
Yeah, and what we face too is because of the size of our county, and we have Littlefield and we have Colorado City. When we have deaths up there, we have to transport those bodies back. And so currently the contractor has built and put what we call stations, and it has to be under surveillance. It has to be locked, and it has to provide the correct coolers with basically almost like vaccines. It has to, maintain a temperature so that for the safety of the medical investigators, that if it's 1 o'clock in the morning, they can provide a place that they don't have to drive all the way back to Lake Havasu, so like that. So we would have to possibly follow the same practice on that. But because of the size of our county, we have those issues of transportation. And that's what the distribution list is it creates a geographical area. So funeral homes within that area respond to law enforcement within 30 minutes. And that is, again, that's law enforcement on their side. They can't wait there for 2 to 3 hours. They have limited staffing and they have to be able to provide those services to our community members. So that's why we have the distribution, the rotation list that provides a 30-minute response time for funeral homes.
Very good.
Yeah.
The area south of Kingman seems it would cover
the
it'd
be a good
majority
area.
of the county. So very
Along
good.
the 40,
Yeah, thank you.
Okay, any other questions or comments? Okay, moving on to the next item. Number 5 has been withdrawn. So that leaves us to any other business. Any items that anyone would like to see put on the agenda for next meeting? I don't see any. Do we have a date for the next meeting?
It will be December. I think it'll be in Kingman, but I will have it sooner than later. So within the next 2 weeks, I will send out a save the date.
Okay.
Can I ask a question? When was the last time you met in Bullhead City?
Yesterday.
The board? The
He's
Board
in
of Health did
Tennessee.
not meet in Bullhead City yesterday.
That's
I
my
know I
favorite
was
answer.
late.
Yesterday.
I was late, but I wasn't that late.
So historically, and that's a good point to bring up. So for my staff sometimes, and for you, I think how it's happened organically is that, with board's attendance and engagement, sometimes it's hard for physicians or for elected officials or for your positions to come during the day. It's a challenge. So I think it slowly, organically moved to nighttime from 5:30 to this time after normal work hours. And then we started rotating between the 3 cities. And I'm open for that. I wouldn't mind keeping it just in Kingman and the chambers there, but I understand I would like to keep it during work hours just for my staff, but if that's not possible, we can accommodate. But I would like to take any direction from the board on that or any
So we
consideration.
could place that on the next agenda to discuss.
A proper
meeting times
rotation
and
or meeting
locations.
times. Okay.
The reason I brought it up was because I thought there might be an issue of where to meet. And I would work on that for you, no problem.
Okay.
So are these meetings held in the other communities recorded for the public?
Yes, they are. They're each one. So that's we have to have a recording to be able to, so we can transcribe, but also provide, it's a public meeting, so it needs to be within a place that can be televised or that. So it's here, and obviously in Kingman, it would be in the chambers of the Board of Supervisors, and it would be in the city chambers too, I believe, for Bullhead, so.
That would be a first, wouldn't it, Jean? No, I didn't say that. Take that off the minutes. I'm kidding. Thank you.
Thank you.
Any other comments before closing? We are adjourned.
Thank you.
Good night, everyone. Thank you for coming.
Thank you.